We're joined by Dr. Maurit Beeri, the Director General of the Al-Ain Hospital's Pediatric and Adolescent Rehabilitation Center in Jerusalem. Thank you so much for being with us here. I want to say, sadly, it's been somewhat, relatively at least, easy for the world to stay calm, as most of the victims of this virus have been elderly. But with the schools planning to reopen now at the end of the month, are we entering a new phase, perhaps, of mutations or increased danger to kids?
So we're not yet, but we have to be very vigilant. The way that the virus is spreading right now, it's just affecting a large proportion of the population. If in the first and second waves, we used to see one person in family get infected and the others in the family might not seroconverse, now we see a high percentage of the people who come in contact with positive patients actually become positive themselves. That actually means that a lot more children are infected with the virus. It doesn't necessarily mean that this virus is more dangerous for children. But if you have something that becomes very, very common, then even rare instances then appear. So if you have 1,000 children get the virus, maybe one of them would get sick. That still is very, very rare. But if you have 40,000 children get sick with the virus, that will create a larger number of children who actually present with worsening symptoms than we used to see. No. So I would say that right now it's a reflection of the spread of the virus rather than the danger that it presents.
Are there high-risk categories emerging here? Are these children in bad condition? Do we know any pre-existing issues, or what's to be the area of highest concern?
Yes, we know that the children who are now in critical condition are all children who had previous significant medical issues. I'm not talking about the child who comes and has a asthma or even diabetes, but children with severe conditions, acute conditions, and mostly heart and lung issues and metabolic diseases. But I do have to say, being in charge of a hospital that treats mostly children with special needs and complex cases, that we haven't seen a rise in the number of children with disabilities and chronic conditions that are flooding our hospital very, very sick. It's still very rare. Within that rare condition, it is true that the sickest kids now are ones presenting with chronic conditions, but it still is a rare effect.
At least that. Along these lines, do you think that Israel is likely to see the vaccines approved for all ages, for children included?
Well, I think I don't think that we will be the first to do that, because that really is taking a step forward that hasn't been done anywhere before. I know that in the United States, they're now rolling out the vaccine in a trial mode for children between 12 and 16 years of age. And since up until now, and with the current mutations, as far as we know, younger children are not the highest risk. I think it will take a while before anybody will take a decision to vaccinate children younger than that. There could be specific populations within that group that we may roll the vaccine earlier because they would have specific issues. But I don't see giving out vaccine to all the children of Israel anytime soon.
Thanks so much for your time here. A valuable and obviously important topic to us all here. Dr. Maurit Beeri.